Then you'll go to the doctor. Then we have the radiologist, we have the nurses, we have the orthopedic review. And in our play, we are going to base on something like a fracture. So the patient will be like a soft tissue injury and on the leg and in an arm fracture. As we see, the play has begun, and the play has begun by when the patient is brought into the hospital and the patient is accompanied by a social worker. Remember, even in KMTC, there is a part where they train the social workers. So the patient comes to the hospital, is received by the social worker, and when the patient comes, he comes accompanied by either the partner or the mother. And the first thing the social worker does is take the patient if he's not walking. Like for our patient, she's not walking. So the social worker will take the patient, he will give the patient a wheelchair, and the social worker will be moving with the patient from one station to another station. And as we can see, the social worker accompanied the patient and the mother to begin at the records office. And for the records office, there is whereby the records officers, they are the first people. They take the biodata of the patient, that is the name, the age of the patient, and the place from there the patient comes in. And they record all the information on a book when they enter. Because the first thing is, when the patient comes into the hospital, the information must be recorded. You can't just attend to the patient without the record. So that's the importance of the records office at the hospital, to make sure that all the information has been taken. And from there is whereby the social worker also accompanies the patient and the mother, and they go to see the doctor. It might be a doctor or clinical officers. Both have been trained to look at, to examine the patient and to diagnose. And for our patient right now, the patient has been taken into the doctor's room. The doctor will examine the patient. He'll make sure that what does the patient present with. He'll make sure that you observe he'll do the physical examination to make sure that despite the other complaints that the patient has come with in the hospital, to check if there's other complaints that the patient cannot know. Si you like ukienda ofisi ndio, the kazi ya daktari, he must make sure that despite what you know, he must find out what don't you know, like can you walk? Is your legs okay? Because when they come first, the doctor will check the eyes. First will begin with the breathing, the airway, circulation, to check that the patient is breathing well, the patient doesn't have any injuries in the eyes, nose, the whole body, physical examination, then diagnose the patient if there is anything else apart from the main complaint. And from there is whereby the doctor will write whatever he has received, diagnosed the patient with any complaints. The doctor will write in the patient's book, and the patient will be taken to the radiologist. For our patient, he has been taken to the doctor, has referred the patient to the radiologist. Since the patient came in complaining of the arm, he says that he got an injury on the left arm and on the leg. So in the radiology, the doctor will send the patient to do some x-rays and other tests, at least to check if there is it broken or just a soft tissue injury. And also, despite radiology, for our guy here, Mr. Favor, he will also do the lab testing. Despite the x-rays, he'll also do the laboratory testing to make sure that despite having the injury, there may be the blood, check the blood. He might check if the patient has any other conditions. And from there, our patient will be taken back to where? To the doctor. That is, from the doctor to the radiologist in the lab. There they will find, the lab will do their testing. They record the testing and whatever they have found on the patient's file. And from there, from the laboratory and the radiologist, they also be given an X-ray picture, whereby when they come back to the doctor will look at the information that has been done at the laboratory. If it's about the injury, the doctor will write to the patient that we can now refer you to the orthopedic or the orthoptician, at least for somebody who has specialized in bones, kuna orthopedics, they have specialized in bones. So because daktari has done his part, you'll just send the patient to the orthopedician, daktari wa mifupa, who will also read the x-ray. He will write the notes down and see what the patient can be managed at. And for our patient, right there, amepelekwa at the orthopedician trauma. For there, the doctor will observe. He will check in the x-ray chart, as you can see. He's looking in the x-ray chart and determine the type is either fracture or soft tissue injury. And he will be the one writing the notes. Because he has specialized in that part, they know what to write, they know the medication, they know the management. And he will make sure that in the hospital we say that everything must be written down, because once you begin from the health records to the doctor, they are in different departments. Now, if you don't record everything, you will not know what has happened. And for our patient, he has the notes from the doctor, he has the notes from the radiologist, from the lab. He has taken now the file to the radiologist, the orthopedician, who will, after writing the information, prescribing the medication, and doing some management. Remember, if the patient has a fracture, the orthopedician, the person who has specialized in orthopedics, will make sure to manage that patient so that at least something like immobilization to prevent further injury to the arm. It may do even the casting, the traction for the patient, so that when the patient, to at least facilitate faster healing of the injury. And that's how we coordinate at the hospital. And for our patient right now, the orthopedics officer is dealing with the patient by at least making sure that the hand has been immobilized to prevent further injury. And there, the file will be taken back to the nurses. After the orthopedician office, the orthopedician already has done his part, the patient will be taken to the nurses at the ward. This is because the patient has a fracture. And if the patient has a fracture, the patient cannot be taken back home to go and manage themselves. Remember that this is a severe injury. So the patient will be kept at the hospital, that is admission. And during the admission, after the patient has seen the doctor, he has seen the orthopedic officer, and from the lab, the patient has to be admitted. And during the admission, it is the nurses who make sure that the patient has been given full management, that is from the prescribed medication. The nurses will make sure that the patient is at least recovering. The nurses will make sure that the patient is at least feeding. The nurses will make sure that the hygiene of the patient. And also, remember, the patient doesn't know what is happening to their body. So it is the work of the nurses to explain to the patient whatever has happened to him. First, they'll tell the patient, this is what has happened to your body. This is how we are going to manage you. This is how we will make sure that in your management, we are going to involve you. For quick recovery, we will at least tell you that once the patient has a fracture, at least they will teach the patient some exercises, small exercises. They will tell the patient what to do as our patient is heading to the nurses, that is, the patient has been admitted at the hospital. And during admission, the first thing is the nurses, they receive the file. Once they receive the file, they see what has been written through the file. And the first thing they do is do the physical examination also and the history taking. So for our nurses, first they will take pressure. They will check the vitals, that is pressure, temperature, as they record each and everything. They will ask information from the mother. Despite that the doctors have some brief information on the patient written on the file, the nurses always begin also their work. Remember, the work of the doctor and the nurse, they have different parts where they play in. So the nurses, they will make sure they take their own history, they document whatever they found from the patient, and they will decide on the management according to what has been prescribed. Remember, despite the pharmacological that the doctor has written, remember the doctor, they only do the pharmacological part. And we say pharmacological part is the doctor prescribe the patient and giving medication. And despite prescription and giving medication, nurses come in whereby they say that this patient, what does the patient lack? as in for this patient to get well soon, what does the patient needs? First, they will check like nutrition, what does this patient needs to eat? They will check hygiene of the patient, what does this patient see? And nurses, because nurses to when you see, as one nurse attends to that patient, another nurse takes the file and goes to the pharmacist, and to the, at the pharmacist, they take the drug that has been prescribed, and the nurse, after being given the drugs, as we can see, she goes back to the wards. And during admission, the first thing that the nurses also do, despite the vital signs, taking the vital and history, they give the medication. Remember, this patient had been pain. They make sure first they give a drug that they can relieve some pain. They make sure that, remember, when you come to the hospital and you are sick, you must be given a medication. The first thing you are given medication, the start dose. Since you are not in a good situation, you are given some medication. That is the part of the nurses. So they make sure they give some fluids. As you can see from there, there's some fluids. They give the patient fluids. Maybe I may lose some blood, and they give everything that the doctor has prescribed. It's always the work of the nurses to make sure that the patient receives all the care that they need. And for the part of the social worker, once the patient has been admitted at the hospital, remember the social worker will go back and look for other patients. But now here is whereby most people who are doing the most part is the nurses during the admission. They will make sure that the patient receives everything. And for our patient, the nurses have administered the drugs. The patient is at least asleep, and remember in the hospital, at least the patient must have one person from the family, either the partner or the mother. And for our patient, you can see it's still there with the mother, as the nurses continue doing their work. And nurses continue doing, in admission, it can be admitted for 3 days. And for those 3 days, with the medication that has been prescribed, the nurses will continue administering the first dose for the first day, second day also, third day also, as they document each and everything. And for the orthopedic review, he'll always make sure that he goes to the ward, check the patient, see if there's any improvement at the patient's side. He will check the wounds, he will check the fractures that he had immobilized, and make sure if the patient recovering. And not even in the ward, like it's all a cooperative or a collaborative, because even during ward rounds, they also need the doctor to go and also do what? Check the patient. So during the ward, we need the doctor for the doctor's ward round. We need the orthopedician to make sure since it was a fracture. We also need a nutritionist who will check that is the patient following up on the nutrition that has been written to him or her. So it is always a collaborative. And even the social workers coming when it's time for the patient to be discharged, and the patient is not able to at least pay their bill. Social worker will always come in, they will take the patient information, at least see how they can waive. It is always the social workers also who will come at the ward and listen to patients' cases, and they go to the administration, let's say like the MEDSO, they discuss the issues, see how they can settle the payment of some patients. Since not all patients can pay. Kuna mgonjwa anakuja hospitalini na hawezi jilipia bill. It is always, we always call the social worker tunamwambia this patient alikuja hosi tukamtibu. But right now, hayuko able to pay for the bill. Social worker will always come in, they will talk to the administration, they will take the files, they will take back the files to the records office, and in the records office, they will clear up on the patients so that the patient can be discharged. And that's how we collaborate at the hospital. So after 3 days, probably the patient will be okay. After everyone has done all their job, that is the nurses, the doctor, the nutritionist, the social workers, the lab, the pharmacist. The work is done, and that's when the patient is at least recovered and gone home. And for our patient, I think she's now okay. And it is always the nurses who are the last person to hand over to the social worker and the health records office. For our patient, I think she's okay, and now she can leave us from the hospital.